It is correct that I compared cercovirus to another vaccine in South. That other vaccine was a vaccine that was only licensed for growing pigs. When I compared these two vaccines side by side, cercovac definitely was much better, induced a higher immunity in these sows and also higher immunity in the piglets that were farrow to these sows. My recommendation of sow vaccination in pigs would be that if I would use sow vaccinations and sow vaccines in general, I would use cercovac. When would I use it? I probably would use it if I would have a problem in young pigs, especially in young pigs, because then it helps most, because it gives the piglets protection at a very critical age that you could not cover with an active vaccination. I would probably also use sow vaccination when I have a problem in the end stages of the growing pig phase, because an additional booster with the milk could only help the piglets and could only promote further growing pig vaccines. Efficacy of PCV2 vaccines is really a two-sided thing, because you need to consider the vaccine, but you also need to consider all the factors of vaccination. All of these factors of vaccination, of the vaccination process, could have errors in it. For instance, the vaccine could have been used past its expiration date, or stored at the wrong temperature, or used in the wrong dose. In addition, the pig itself could not be susceptible at the time of vaccination due to concurrent infections, or the vaccination crew did miss some pigs and they did not get vaccinated. So vaccine failure investigations are most often very problematic, because after the fact, after the pigs had been vaccinated, it's really difficult to find these errors in retrospective. This is almost impossible. So the only way to evaluate these vaccine failure situations is under experimental conditions to test a vaccine with a known challenge and see if it works or not. And to my knowledge, whenever we tested current PCV2 vaccines, which are all based on PCV2A, they all protected nicely against PCV2B and also PCV2D. Well, the reason for the appearance of new genotypes of PCV2 is just a normal evolution. Some stay in the PCV2 population because probably they are shielded from the antibodies that are built from the pigs to protect the pig from the virus. Others disappear because they don't have that protection, and they basically just get neutralized from the pig itself or from the immune system. I don't think that we can limit the appearance of new mutants and genotypes, because that would require that we know how the virus is going to change. However, I do believe we probably can do some prevention in general, in that we, for instance, use vaccines that cover most of the genotypes. The perfect PCV2 vaccine that I can see in the future is a vaccine that protects against all common field strains, that reduces viremia much better than the current product, that is easy to apply, and that is really inexpensive. Well, monitoring of PCV2 on farms, it's routinely done by PCR on serum samples. It's also done by PCR on oral fluid samples. However, PCV2 is an ubiquitous virus, which means it every farm will be positive, finding a PCV2 PCR positive sample in our fluid is basically meaningless, because that would be on any given farm anyway, regardless of importance to the pigs. So if I would monitor a herd, I would just do that based on serum PCR. Another tool for monitoring a pig farm would be using antibody assays. I know that most people don't like to use antibody assays because most farms will be positive, but I believe if you look at titers of antibody levels, you could get a good hint on what is going on, when do the pigs get infected, and so on. In farm monitoring, it really depends what your desired outcome is. If you want to know if disease is there, then obviously you probably need to investigate diseased pigs and do an immunohistochemistry and pathological lesions. If you are just interested if PCV2 is there and which strain is there, then you probably just need to do PCR and serum samples on a subset. Normally people do a subset of 30 and they do pools of 5 serum samples. And I would all PCR positive samples routinely check for the main genotype by either open reading frame 2 sequencing or by multiplex PCR.